I request the first speaker, Dr. Naina Hyder, to come on stage and present her talk on pursuits and saccades. Dr. Naina is the Associate Professor of Ophthalmology in Regional Institute of Ophthalmology, Trivandrum. She is heading the Department of Pediatric Ophthalmology and Strabismus for more than 10 years now. Over to you, ma'am. Welcome, Dr. Rashmin Gandhi, to this.
Good morning, and I see a crowd which is interested in abnormal ocular movements. I'm surprised. Anyway, saccades and pursuits. The fundamental goal of the visual system is to detect objects and motion in the environment, and it is to track and keep the fovea with the objects of interest and get a high spatial resolution. So the oculomotor system directs and holds the fovea in alignment with the objects of interest with six supranuclear systems, namely the ocular fixation, the vestibulo-ocular system, optokinetic, saccades, pursuit, and vergence. The oculomotor tracking systems, the ocular fixation system is a fast, whereas the saccade is also a fast system. The VOR, the OKN, and the vergence are slow. The ultimate purpose of the oculomotor system is to establish a clear, stable, and binocular vision. And the two basic eye movements which help to perform this task is gaze shift and gaze stabilization. The cortical centers controlling the eye movements, you can see there are many, but the frontal eye field stands out as the hero number one. And when you can see the parietal eye field, the medial supratemporal visual area, the striate cortex. So these are the areas which are important in the cortical area, which will have the eye movements control. And another area is the brainstem area, which the PPRF, the MLF, the vestibular nucleus, the cranial nerves, the sixth, third, and fourth are linked in the midbrain. The MLF, we'll be coming into it. So coming to saccades. Saccades means to pull. It's a French word, sacquer. That is, it is a rapid pull, like on the reins of the horse you pull, and you can rapidly shift the fovea to the target of interest. It's described as a ballistic rapid eye movement that cannot be altered once initiated, and the speed of the saccade correlates with the extent of eye movements. So this is the saccade eye movements, which is the rapid eye movements which you see. And the initiation of the saccade, you have a pulse and a step. So the saccade, in the pulse, you have which enables the globe to overcome the inertia and viscous drag with the orbit. So it starts with the pulse and ends with the step. And the pulse determines the saccadic velocity. The step maintains the position of the eye after the saccade. So, but each, the pulse and the steps are controlled by different centers. In the brainstem centers, the pulse of the horizontal saccade is by the PPRF in the pons, and the step is the medial vestibular nucleus and the nucleus preproprius hyperglossi. For the vertical saccades, the pulse is done by the rostral interstitial nucleus of MLF in the midbrain, and the step is the interstitial nucleus of Kajal. There is a phenomenon of neural integration in saccade, and for the saccade to be accurate, the velocity of the saccade, that is the pulse innervation, must match the final ocular position maintained of the saccade is complete, that is step innervation. So pulse, step. And this process of matching the pulse and the step components of the saccade is referred to as neural integration. The characteristics of saccades, velocity, duration, waveforms, trajectory, latency, and accuracy are all important you have to see during a saccade. And the velocity is, as I said, it's a very ballistic movement, 500 degree seconds, and the latency is 200, and the duration is less than 100 milliseconds. So testing of the saccade is self-paced or verbally guided. And this video will show that you have two targets kept symmetrically apart, and the patient is asked to look into those targets. You have horizontal saccades and vertical saccades being checked, and you can also go torsional. Oblique saccades are also checked. And you can also have the verbally guided saccade, that is, you can ask the patient to look at your nose and a target on one side, and you can verbally ask the patient to look to your nose and then to the target. So on the either side, or vertical and oblique. Come to pursuit eye movements. It allows continuous clear vision of the objects moving within the visual environment. If the motion of the target is unpredictable, pursuit shows a lag. And if the target motion is predictable, there is no lag. That is, in the first case, if you have a fly beating around you just now, so it's going to be, the pursuit is going to show a lag. But when you have a very smooth, continuous movement, like the child on a swing, there is no lag. That is how they have described pursuit-eyed movements. And pursuit-eyed movements are very slow movements. And it is just by looking to a target which is moved very slowly, horizontally in the visual space, and also upwards and also diagonal. So for the pursuit system, you have a frontal eye field, and it is a double decussation system. So it is an ipsilateral system. So you can see in the dorsal area, that is the midbrain, you have those fibers coming, the temporo-occipital fibers coming in from the frontal eye field, going into the midbrain, coming into the cerebellum and the flocculus, and then also going, so it's a double decussator. So all the pursuit movements are going to be ipsilateral, whereas the saccades are going to be contralateral in cortical lesions. So the clinical importance of these pursuits and saccades are the supranuclear systems are pathways that converge at the level of the brainstem to innervate the oculomotor cranial nerve nuclei. Their separate origin allows selective disruption of these oculomotor system by disease processes. Therefore, a targeted clinical examination of these systems allow the clinician to identify the affected system and determine the responsible disease process. Thank you.
Thank you, Dr. Naina, for that very exhaustive presentation, getting into the basics